Have you ever wondered if your body can whisper warnings weeks, even a full month, before a stroke occurs? The truth is, it can. Strokes don't just strike out of nowhere. In many cases, your body gives off subtle clues ahead of time. Clues that are easy to miss, misunderstand, or dismiss entirely. That's why this video is so important. Today, we're uncovering 7 early warning signs of a stroke that can appear days or even weeks before the event. These symptoms often fly under the radar, but could signal serious neurological danger. And here's the reality. You don't have to be elderly, chronically ill, or visibly unhealthy to suffer a stroke. Strokes are increasingly affecting younger individuals, even those in their 30s and 40s who appear perfectly healthy on the outside. No one is immune. In the United States alone, over 795,000 strokes occur every year, and shockingly, about 159,000 of them are fatal. These numbers are not just statistics, they represent lives, families, futures forever altered. That's why it's critical to know these warning signs before it's too late. Recognizing these symptoms early and acting fast could be the difference between a full recovery and permanent disability, or even death. In this video, we'll break down the 2 main types of stroke, ischemic and hemorrhagic, and what causes each, what a brain aneurysm is, and why family history matters. The 7 key signs that could appear well before a stroke actually hits. And here's the part most people don't realize. Even a small, temporary episode, like a transient ischemic attack, TIA, is a red flag your brain cannot afford to ignore. Think of it as a mini-stroke, and a major warning of what's to come. If you recognize any of these signs in yourself or a loved one, don't wait. Seek immediate medical attention. Time is not on your side when it comes to brain health. Acting within minutes can make all the difference in survival and recovery. Stay with us till the end, because what you learn today could literally save a life. But before we dive into all that, if you're new here, welcome to the channel. We're here to help you live healthier, feel better, and age vibrantly. Be sure to like this video, subscribe, and turn on the notification bell so you never miss a wellness tip that could change your life. And tell us in the comments, where are you watching from? We love hearing from viewers around the world. Please share this video with someone you care about. One share could be the reason someone gets the help they need in time. One comment could spark a conversation that saves a life. Now let's dive into the first critical warning sign, persistent high blood pressure, and what it's silently doing to your arteries and brain. Warning sign number 1, silent but deadly, high blood pressure. Let's start with the most deceptive threat of all, chronic high blood pressure, often called the silent killer. Why? Because you may not feel anything at all. No pain, no obvious symptoms. Yet inside, your blood vessels are under constant attack. Think of your arteries as soft, flexible tunnels that carry life-giving blood to every corner of your brain. Now imagine a relentless pressure surging through those tunnels day after day, slowly eroding the walls, narrowing the pathways, and weakening their structure. That's what high blood pressure does. And here's the scary part. If those vessels rupture, you get a hemorrhagic stroke, where bleeding floods the brain tissue. If they become blocked by clots or plaque, you suffer an ischemic stroke, which cuts off oxygen to your brain cells, killing them within minutes. Uncontrolled high blood pressure increases your stroke risk exponentially. This isn't just a number on a doctor's chart, it's a ticking time bomb. According to the CDC, nearly 1 in 3 adults has elevated blood pressure, and many don't even know it. Track your readings regularly. Reduce sodium, manage stress, exercise daily, and take medications exactly as prescribed. Don't treat it lightly. Treat it like your brain depends on it. Because it does. Warning sign number 2, sudden, unexplained fatigue. Your brain begging for help. Let's talk about a symptom most people shrug off. Extreme, unshakable fatigue. Now, we all feel tired sometimes. But this is different. We're talking about the kind of bone-deep exhaustion that hits you out of nowhere. You're not stressed. You haven't done anything strenuous. Yet you feel completely drained, physically and mentally. This kind of fatigue could be a neurological red flag. Your brain is incredibly sensitive to changes in blood flow. When arteries become narrowed or partially blocked, the brain doesn't get enough oxygen. That lack of oxygen may not cause pain, but it can cause deep fatigue, a sign that your brain is struggling to function. In some cases, this exhaustion may be linked to what's known as a transient ischemic attack, TIA, often called a mini-stroke. It's when a clot temporarily blocks blood flow to the brain, creating stroke-like symptoms that vanish within minutes or hours. Don't let the word temporary fool you. A TIA is not harmless, it's a warning shot. Up to 1 in 3 people who experience a TIA go on to have a full-blown stroke, often within just 90 days. So if you're feeling unusually fatigued without explanation, especially if it comes with dizziness, numbness, or confusion, seek help immediately. It might not be just stress or aging. It could be your brain asking for urgent attention. Warning sign number 3, sudden vision disturbances, when the eyes signal brain trouble. Imagine waking up and noticing that the world looks blurry, doubled, or distorted, almost like you're peering through a foggy window. Sudden, unexplained vision problems like this are not just an inconvenience. They could be one of the first signs of an impending stroke. Your eyes rely on a constant, stable supply of oxygen-rich blood. If the artery feeding the retina or the visual cortex of your brain becomes blocked or narrowed, your vision can quickly deteriorate. This is especially true in ischemic strokes, where a clot impedes blood flow to specific brain regions. Symptoms to watch for include blurred or double vision, partial vision loss in one eye, trouble focusing or tracking movement. Even if these symptoms last only a few minutes, don't wait. They may indicate a transient ischemic attack, TIA, a brief interruption in blood flow that often comes just before a major stroke. If your vision changes suddenly, without an obvious reason like eye strain or fatigue, treat it as a medical emergency. You could be saving your eyesight and your life by seeking immediate help. Warning sign number 4, the thunderclap headache, a pain like no other. Not all headaches are created equal. Most are harmless, caused by stress, tension, or dehydration. But when a headache strikes suddenly with extreme intensity, as if a thunderclap exploded in your skull, it could be something far more sinister. This kind of pain often marks the onset of a hemorrhagic stroke, where a blood vessel bursts inside the brain, causing bleeding and rapidly increasing pressure inside your skull. What sets it apart? It's not gradual. It comes on instantly. It's described as the worst headache of your life. It may be accompanied by nausea, vomiting, blurred vision, or loss of consciousness. Such a headache could also signal a ruptured brain aneurysm, a life-threatening condition that demands immediate surgery. Don't assume it's a migraine or brush it off. Call emergency services immediately. Delaying even a few minutes could lead to irreversible brain damage or death. Warning sign number 5, sudden numbness or weakness, especially on one side of the body. You're lifting a cup of coffee, and suddenly your hand goes limp, or your leg feels heavy, numb, or won't support your weight. These aren't just clumsy moments. They may be a frightening signal that blood flow to part of your brain has been compromised. Strokes typically affect only one hemisphere of the brain, which is why symptoms often occur on one side of the body, whether it's the face, arm, or leg. This could be a sign of a TIA, which can strike and fade within minutes. But make no mistake, a TIA is a red alert warning that a major, possibly fatal stroke could be just days away. If you feel sudden weakness, numbness, tingling, or a loss of motor control on one side, don't wait for it to go away. Get to the ER immediately. Quick action could prevent a lifetime of paralysis, or worse. Warning sign number 6, slurred speech or trouble understanding words, when language fails. Communication is one of our most vital abilities. But during a stroke, the brain's language centers, located mostly in the left hemisphere, can be severely disrupted. The result? Sudden speech problems, even in someone who was perfectly articulate moments earlier. Watch for these signs: slurred speech, inability to find words, difficulty understanding others, speaking gibberish or nonsensical phrases. This condition is known as aphasia, and it's not just frustrating, it's terrifying. Often, it's one of the earliest indicators that a stroke is underway. If someone's speech suddenly becomes incoherent, or they appear confused by simple questions, don't hesitate. Call 911. Delayed treatment could result in permanent communication loss or death. Warning sign number 7, subtle neurological changes, your brain's quiet cry for help. Sometimes the body whispers before it screams. In the days, or even weeks, before a stroke, you might notice odd neurological symptoms that seem minor or unrelated at first glance. These can include sudden memory lapses, loss of balance or coordination, dizziness or unsteady walking, nausea or unexplained vomiting, momentary confusion or trouble concentrating. While these signs can also stem from other conditions like migraines, seizures, blood sugar crashes, or even anxiety, you should never try to self-diagnose. If you experience any unusual, unexplained neurological symptoms, consult a neurologist without delay. A full evaluation, including imaging and vascular screening, could detect hidden risks and help you prevent a devastating stroke. Ischemic stroke versus hemorrhagic stroke. What's the real difference? When it comes to strokes, there are two main types, and understanding the difference could one day save your life or someone else's. 1. Ischemic stroke, a sudden block in the brain's lifeline. An ischemic stroke occurs when blood flow to a part of the brain is suddenly blocked, usually by a clot or a buildup of plaque inside an artery. This is the most common type of stroke, accounting for about 85% of all cases. So, how does it happen? One common cause is atrial fibrillation, an irregular heart rhythm that can cause blood to pool and form clots in the heart. These clots can travel through the bloodstream and get lodged in the narrow arteries of the brain, cutting off oxygen and nutrients. Another major cause is atherosclerosis, a condition where cholesterol and fatty deposits, plaque, build up on the artery walls, narrowing the passageways and restricting blood flow. When any part of the brain is deprived of blood, brain cells begin to die within minutes. That's why strokes are medical emergencies. Every second counts. An ischemic stroke is like a traffic jam in your brain's highway, and without prompt intervention, it can lead to permanent damage or death. 2. Hemorrhagic stroke, when a blood vessel bursts. On the other hand, a hemorrhagic stroke occurs when a weakened blood vessel in the brain ruptures, spilling blood directly into brain tissue. This uncontrolled bleeding raises pressure inside the skull, crushing delicate brain cells and damaging vital regions in moments. Common causes include uncontrolled high blood pressure, trauma, overuse of blood thinners, and most dangerously, a ruptured brain aneurysm. The impact is immediate and catastrophic. The bleeding not only destroys brain tissue, but also causes inflammation, swelling, and can trigger seizures, coma, or death. A hemorrhagic stroke is like a bomb going off inside the brain, and the resulting damage can spread rapidly if not treated immediately. Brain aneurysms, the silent time bomb in your head. A brain aneurysm is one of the most dangerous and hidden causes of hemorrhagic strokes. Picture it like a balloon bulging out from a weak spot in a blood vessel. It can exist quietly for years, causing no symptoms at all, until one day it bursts. Signs before rupture may include a sudden severe headache, thunderclap headache, vision changes, neck stiffness, light sensitivity, nausea or confusion. While some aneurysms never rupture and can be monitored safely, others pose a serious risk. Fortunately, modern imaging tools like CT scans, MRIs, or cerebral angiograms can detect them early. If you have a family history or feel something is off, don't wait. Getting tested could prevent a deadly emergency. You don't have to wait until disaster strikes. You can take control right now and slash your stroke risk with a few powerful daily habits. Control your blood pressure. This is the #1 stroke risk factor. Manage diabetes and blood sugar levels. Quit smoking. Every cigarette damages your blood vessels. Eat clean, fresh vegetables, whole grains, lean protein, healthy fats. Avoid processed foods, added sugars, and trans fats. Exercise regularly. Aim for at least 150 minutes a week. Maintain a healthy weight. Keep cholesterol in check, especially LDL levels. Limit alcohol intake. Get quality sleep. Sleep is vital for blood pressure regulation. Visit your doctor for regular heart and brain health checkups. These steps are simple, but their impact is profound. They're not just about avoiding stroke. They're about unlocking a longer, healthier life. Strokes are one of the leading causes of long-term disability and death worldwide, but they're also largely preventable. By recognizing the signs, understanding the causes, and taking proactive steps, we can all reduce our risk dramatically. If you found this video helpful, give it a thumbs up. It truly helps us spread life-saving knowledge. Share it with someone you care about, because one small action could make a life-saving difference. And don't forget to subscribe if you're new here. We share powerful, easy-to-follow health tips every week to help you live longer, stronger, and healthier. Have you or someone you love experienced any of these warning signs before? Tell us in the comments. We'd love to hear from you. And before you go, some more health-packed videos are popping up right now on your screen. Tap and watch the next one, and continue your journey toward a healthier life. Thank you for watching. Take care of yourself, and take care of your brain.